healthcare solution in Africa. Miss Adisa.
Yes, thank you so much. I really appreciate the opportunity to respond. I just actually maybe want to go back to the previous question, if you just entertain that for a minute. I think when we talk about my perspective, and I always want to ground the discussion in, where, I'm coming from and sort of the technology we developed. It is more so less clinical based, right? And we're talking about direct care workers and frontline workers, and maybe just slightly contrarian or maybe even amplifying. I think I heard it towards the end of the previous panelists' comments. I do believe everyone needs to be taught AI skills, not just as a tool or as in tooling, but I think the same as it ever was, right? In terms of critical thinking skills and the ability to lean into what makes us human. I think that direct care workers and frontline workers, um, based on the settings that they're working in outside the four walls of the hospital. In the US context, it's primarily post-acute, have to be provided with not only the basics, but also lean in and be amplifying what makes them more human, right? And so the ability to say you are, the direct care work and frontline work has been fighting for legitimacy for the last sort of 30 or 40 years in terms of the overall practice of healthcare. And so I think that some of the dynamics that show up without AI may also show up in AI, right? And so beyond sort of general literacy, I believe also in, the ability for the individual to lean in, take some of the guidance from AI, and then also impart their own best wisdoms and critical thinking skills and what's best for the individual. So just wanted to comment on that just very briefly. I felt very strongly about that. Insofar as opportunities for sustainability, what you're starting to see emerge, and this is something I'm learning a lot more about as well, across West Africa, as well as different countries. You're seeing the opportunities show up for private donors and private lenders to really lean in. I'm seeing sort of a cultivation or a rise of folks within diaspora who have, potentially, exited or have potentially built up successful endeavors elsewhere, and then also sort of lending opportunity within the continent to, be a part of fundraising rounds as well as cultivating opportunities from that respect. We're starting to see even, I believe the Nigerian government sought out a credit facility for I believe digital opportunities for cultivating new companies as well as healthcare initiatives as well. That's primarily on the private side. And so there's a great interest, I think, not just only in the US context, but globally in seeing best uses of AI and, how small companies will emerge. What is really interesting from a sustainability perspective is, and from a funding perspective, is we're leaving sort of this era of SaaS companies, right? In order to build products, you need a lot of people, you need a lot of capital intensivity. I think what is really interesting is that not only in building AI products, but what's behind the scenes, right? And I think DeepSeek in China is sort of a sort of emblematic of a reminder of what the potential of AI is that in building products that um, are using AI, it is also behind the scenes, right, in how those companies are building as well. So there's a really big opportunity to do a lot more with a lot less in releasing products that are really sort of transformative, right? And so, and just to the comments earlier too, right? Using open source models, I think is going to be also very radically transformative. I, for one, I'm very cautiously optimistic about who the products are made for. But I also see the promise of how products are made that are really reflective of different needs and challenges, right? So being able to, locally create products and opportunities to address challenges on the healthcare front. It doesn't take a whole lot of capital, especially if we're talking about open source models and opportunities.
Yeah.
I think I'll answer it from that perspective. I'm not as familiar with sort of the public side, but on the private side, in terms of sort of private equity as well as,
Okay.
yeah, I'm
Yeah.
familiar there. Yeah.
Thank you. Thank you. I think for the sake of time, that should be enough. So on that topic, let me ask Ms. Thomas again. In what ways can small AI running on everyday devices like cell phones and stuff help overcome limited digital infrastructure in Africa, for example? Ms. Thomas.
Yes, thank you. I think I will shift this back to what we were the previous panelists and even Vamshi was talking about when it comes to leapfrogging, right? I think small AI may actually be a really good opportunity to ensure, or like to not to ensure, but like to make sure that within the resource constraints that we're working with, actually be more useful. Um, Small AI runs models on smaller devices, reducing dependency on cloud infrastructure, unstable connectivity, bandwidth, and it could also run on centralized systems. So it can support offline triage in rural clinics, for example, allow for localized language interfaces, reduce latency, enhance data privacy within that space. In the African context, I think there's a huge saturation of using smartphones, and I think that's something that is to our advantage. And that could be used as a computing device for such purposes. We could leverage edge AI on these devices to allow this sector to actually leapfrog infrastructure constraints, right? We don't have to necessarily rely on traditional models of growth here. But again, I think yes, technology is an enabler and it could alleviate a lot of our points, but I do come from the back end of AI. So the data we train it on, the context that we train it on, the languages we train it on, the case studies we train it on is super, super, super vital, right? We cannot adopt like Western forms of cases and say, hey, we're in Africa and it can work here. Absolutely not. It has to be contextualized because it's very nuanced here. Yes, AI is super great. Yes, ChatGPT is great. It makes my emails sound super polished whenever I write them, right? However, it doesn't make it sound like me. It doesn't pick on the nuances that I'm African and I'm American and I have Pan-African values, right? So just like you have to tweak it to make it sound like you, I think the training data that we have to use has to be very grounded and very culturally relevant and very timely. And so I will always go back to, regardless of the technology we're using, how we train it and how we prep it to serve us, to amplify our abilities, to make patients' life more easier, seamless, and convenient is heavily dependent on what training model, what proper training it gets. So it has to be contextually aware and human-centered.
Thank you.
So.
Thank you very much. That's a very relevant point. Just for Reddit, just for the sake of time, let me make it quick. So the other big issue is this ethical safety and regulatory challenges. So how should developing countries like Africa balance the rapid adoption of AI tools with safeguards for privacy, consent, and data protection? Reddit, just 2 minutes.
Thank you. So I believe we can use AI based on the types of risks that we are facing, right? For example, if we classify the risks, let's say low risk, medium risk, and high risk, right? For low risks, let's say such as admin tasks, right? Like appointments, billings, and logistics, right? These are simple activities where we can highly rely on AI. And we have medium risks, right, where decision supports are required, such as risk scoring or summarizing notes. So what we should do is, based on the risks that we are carrying, we can use or we can craft frameworks on how to use AI, right? So for example, for lower and medium risks, we can easily use AI because it doesn't have that much higher impact. But when you talk about higher risks such as diagnosis and treatment recommendations, well, we need to have a very specific framework on how we can capture that, right? The other one is AI. Most of the AI that we are using is trained on Western data, right? So we need to be able to train our AI on our local data, on our local context. It doesn't mean just because it worked in Europe and US, it will work for us. So gathering the proper data, analyzing the proper data. So from data perspective, we need to have a strong data governance framework that we will train our AI on. So these are the two major items I think will be a great input for our the regulators to create their framework. And most of all, AI, right? So it doesn't replace humans, right? So in each and every part of it, humans needs to be in loop, right? So we cannot leave everything to AI. So humans need to be able to say stop, right? We need to be able to override it. We need to have a continuous monitoring, right? After post deployment or using the having AI into the workforce, we need to have a continuous monitoring on how decisions are being made, right? From this aspect, incident reporting needs to be in place, right? So is it harm or is it near miss? These kinds of things. Regular audits need to be there. Version controls needs to be there. So unless we have this frameworks properly defined, it's going to be very hard just to use AI because it's out there.
Okay, thank you. Thank you for that. With the remaining time, I think we have like 2 minutes. I'd like to give a chance to Ms. Adisam. One more issue on balancing innovation and equity. So how can AI be leveraged to reduce health inequalities rather than deepen them, especially given disparities in digital access across population in Africa?
Absolutely. I'm also reading the chat and responding also live in the chat. I think there's some really great comments there, but I think a lot of the panelists as well as previous speakers have spoken very well to these opportunities. Specifically within, I think it's the decolonialization of AI, right? So there's sort of a lead start already, and you have the intent and the people who were sort of like the inputs already are already leverage some extent of some of the systemic inequalities that are very present. And so I think you can't sort of build on top of brokenness. I think it is creating brand new models and brand new ways of leveraging AI. I completely concur across the panelists and some of the comments within the comments section, right? It is to undo and create from very nativist opportunities. I think that's the best way in which you can sort of really move forward in an AI future, right? Instead of using and depending on models that were constructed with what we already know are inherent biases, right? We already have inherent biases that exist within sort of our healthcare context. And so I'm being sort of really mindful to that. I'll put it in short just to for the sake of time.
Thank you very much. Thanks, everybody. I think just right on time. Thank you again to our distinguished panelists, our organizers, and everyone in attendance. Let's carry this momentum forward and continue working toward the future where AI contributes to a stronger, more resilient, and more equitable health system for all. Again, thank you for that wonderful panel. Appreciate that.
Excellent.
Thank you for moderating.
Thank you.
Exactly. Thank you for all of you. Amazing panel indeed. Without further ado, to allow even more exciting discussions, Dr. Ketia Achebe will be moderating the next panel. Just to give a quick overview of Dr. Achebe, she's a global health physician and leader with more than 20 years of expertise advancing public health systems worldwide. She's recognized for building cross-sector partnerships, strengthening health workforces, and mobilizing large-scale initiatives that improve health outcomes across more than than 100 countries. She previously led the Peace Corps Global Health and HIV programs across 64 countries and held senior leadership roles at Save the Children USA, Africare. She holds an MD, an MPH from Boston University, and advanced training in infection